We're moving from a pandemic to an endemic. Health officials revealed that in today's Department of Health and Welfare briefing. So what exactly does that mean? Our Shira Matsuzawa listened in on the presser and explains what that term, endemic, means.
On December 14th of 2020, I told you that that day was the D-Day in the battle against coronavirus. And sadly, today I'm here to tell you that we've lost the war, that COVID is here to stay. And the reason it is here to stay is because we cannot vaccinate enough of the public to fully eradicate the disease. And absent being able to do that and accomplish herd immunity, we now need to move into the phase of recognizing that COVID is going to be a disease to be managed for the long-term future.
A sobering remark coming from St. Alphonsus Chief Clinical Officer Dr. Stephen Nemerson during Tuesday's Idaho Department of Health and Welfare COVID-19 media briefing, and something echoed by many of the healthcare leaders on the call.
A lot of experts now feel that we are probably this virus is not going to go away, is very likely going to continue to circulate. And we can only hope that over time it becomes a milder and more tolerable virus, if you will.
As of Tuesday afternoon, the state said 53% of Idahoans 12 and older were fully vaccinated. And while the number of COVID patients remained high, there was a slight decline. But Director Dave Jepson said the number of patients continues to exceed the number of healthcare resources in the hospitals.
For the first time in 3 months, we've finally seen a small decline in COVID spread in our communities. This is not universal across Idaho.
Dr. Nemerson adds at St. Alphonsus, they're only delivering urgent and emergency care.
We've shut down all but medically necessary time-sensitive procedures.
And it's taking a toll on the healthcare professionals. While they're protected by the vaccine, they're experiencing physical and emotional trauma, witnessing people dying on a daily basis. And as the holidays round the corner, State Public Health Administrator Elke Shaw-Tolik says we need to be vigilant.
Holidays and events where people gather are ripe for the spread of COVID, as we know, particularly for those who are unvaccinated and especially for our young children.
Now, as we've reported previously, there is a backlog when it comes to many of the local public health districts and the number of COVID cases they're seeing. Today, the state said there are roughly 9,000 cases in the red, so to speak, but they're offering assistance to the local public health districts to see if they can help them get caught up. But for a complete breakdown of what we discussed or what was discussed during today's briefing, just head on over to our website, ktvb.com.
Shira, thank you.